Good afternoon. My name is Jung. I have been attending a doctoral course in Crisisonomy, Chungbuk National University in Korea. The title of the article is Improvement on National Crisis and Emergency Management through a Core System. It is based on the lesson of MERS and COVID-19 crisis. Infectious diseases are the most terrifying enemies threaten human lives. COVID-19 easily mutate. We can beat out vaccines and treatment. Even if COVID-19 disappears, new infectious disease will appear. To survive this, we must analyze present situation coolly. We need to find problems and improve them quickly. This article studies core system and crisis management model. A core system is a network hub. It leads and coordinates a whole system in a certain direction. When functions and rules for key elements work properly, the national crisis management system results in a successful outcome. Professor Lee Jae-eun of Chungbuk National University saw the major elements of core system as value, institution, leadership, devotion, and expertise. Crisis management model consists of four phases: prevention, preparedness, response, recovery. Crisis management is the process of developing and implementing policies to prevent and prepare before crisis. When the crisis occurs, it is a process of responding to minimize damage and recovering to return to its original state. Laws related to infectious diseases is the Act on the Prevention and Management of Infectious Diseases, the Quarantine Act, the Medical Act, in charge of the Ministry of Health and Welfare, the Framework Act on Disaster and Safety Management is in charge of Ministry of Public Administration and Security. First of all, I will give a brief presentation on the MERS and COVID-19 crisis. MERS has occurred on May 20th, 2015 in Korea. 68-year-old man who arrived from Bahrain was confirmed to be infected with MERS. Crisis alert level was upgraded to level 2. In a week, 7 were confirmed and 61 were quarantined. On June 9th, comprehensive response was required, but crisis alert level was not upgraded. The actual response was at level 4. On July 28th, no more new confirmed cases occurred. 186 were confirmed, and 38 died. The fertility rate is 20.4%. 16,752 were self-quarantined. The first COVID-19 confirmed case in Korea occurred on January 20, 2020. Case alert level was raised to level 2 after increase by more than 2 a day. On January 27th, the crisis alert level raised to level 3. Since February 18th, many believers in Shincheonji had been confirmed. Since then, the number had doubled every day. On February 23rd, the government raised the crisis alert level to the highest level 4. In early December, in Korea, more than 38,000 were confirmed, and more than 500 died. More than 3 million had testing. All over the world, more than 66 million were confirmed. More than 1.5 million died. Fertility rate is about 2.3%. Through merit and COVID-19, this article analyzed the problem of crisis management system in Korea. It was used 5 components of core system model and 4-step crisis management model. First, I will look into the problems of various crises. The government tried to cover the hospital's losses rather than the best value of protecting lives. The denial of hospital disclosure resulted in the spread. It had not taken measures to prevent MERS despite the World Health Organization warnings. There was no emergency situation room prepared to infectious disease. It spread because of incorrect epidemiological investigation criteria and failed to respond in the initial stage. There was a lack of compensation for damage to the hospital in terms of recovery. Leadership temporarily was interrupted because the demand headquarters was changed during the spread. All 1,600 people who attended the meeting were asked to devote themselves to self-isolated. In terms of expertise, epidemic intelligence officers were not enough. Even large hospitals did not have negative pressure rooms and enough protective clothing. This time, I will analyze problems about COVID-19. During the COVID-19, in terms of value, excessive disclosure of information raised the issue of human rights violations. It operated the countermeasure support headquarters with deputy health system. It was not even in the act in terms of prevention. The government delayed issuing alert level despite the spread of Shincheonji Church in terms of preparedness. The initial response was delayed in order to boost domestic demand. Emergency reliefs for recovery damage had different payment standards between the state and local government. Jointly operating, the deputy director of command headquarters caused confusion in terms of leadership. The people complained of fatigue due to long-term devoting to social distance, securing vaccines and developing treatment was behind other countries in terms of expertise. Next, I have suggested ways to improve our national crisis management system. We should disclose the movement of the confirmed case to the extent that it does not infringe on human rights. The central government and the local government should be evaluated crisis management capabilities and disclose the result. The crisis alert level should be raised in case of domestic inflow. The government should decide policy direction through a comprehensive assessment of the situation, and the public should actively cooperate. The government should prepare standards for the payment of emergency reliefs. General Commander-in-Chief should be raised to Prime Minister or President. The government should implement a minimum distance policy in life to address both the economy and disease control. Developed vaccines and treatment are fairly distributed to poor countries through international cooperation. After 5 years since March 2015, the same problem has emerged during COVID-19. Korea has been praised all over the world for okay disease control. We gained know-how after suffering from virus. We will learn bigger lessons from COVID-19. If a new virus occurs in the future, we will respond better than it is now. Thank you.